USMLE Question 1. A 28-year-old woman presents to the clinic for a routine checkup. She is planning to become pregnant and has been taking prenatal vitamins for the past 3 months. She mentions that she has been feeling fatigued and has noticed a sore, red tongue. On physical examination, she has a pale appearance and a smooth, beefy red tongue. Laboratory tests show macrocytic megaloblastic anemia, hypersegmented polymorphonuclear cells, and normal methylmalonic acid levels. Which of the following is the most likely diagnosis? A. Vitamin B12 deficiency. B. Vitamin B9 folate deficiency. C. Iron deficiency anemia. D. Hemolytic anemia. E. Chronic liver disease. Vitamin B9 folate deficiency. Explanation. This patient's presentation of macrocytic megaloblastic anemia, hypersegmented polymorphonuclear cells, and a smooth, beefy red tongue is consistent with folate deficiency. Folate is essential for DNA synthesis and cell division, and its deficiency leads to megaloblastic anemia. Folate deficiency does not cause neurological symptoms, as seen in vitamin B12 deficiency. The patient's history of pregnancy planning further supports folate supplementation, which is recommended 1 month before conception and throughout pregnancy to prevent neural tube defects. Folate deficiency can be caused by chronic alcohol use or medications such as phenytoin, methotrexate, and trimethoprim. USMLE Question 2. A 34-year-old woman presents with fatigue and irritability. She is in the second trimester of her pregnancy and has been experiencing mild abdominal discomfort and swelling. On examination, she has pale skin and a smooth tongue. Laboratory findings reveal macrocytic anemia with hypersegmented neutrophils. Her homocysteine levels are elevated while methylmalonic acid levels are normal. What is the most likely cause of this patient's anemia? A. Vitamin B12 deficiency. B. Vitamin B9 folate deficiency. C. Iron deficiency anemia. D. Chronic kidney disease. E. Sickle cell anemia. Answer B. Vitamin B9 folate deficiency. Explanation. The patient is presenting with macrocytic megaloblastic anemia, hypersegmented neutrophils, smooth tongue, and elevated homocysteine with normal methylmalonic acid levels, which is characteristic of folate deficiency. Folate is required for the synthesis of DNA, and its deficiency leads to impaired cell division, causing macrocytic anemia. Folate deficiency can be seen during young pregnancy and in conditions such as chronic alcohol use or the use of medications like phenytoin and methotrexate. The key diagnostic marker is the normal methylmalonic acid, which distinguishes folate deficiency from vitamin B12 deficiency, where both homocysteine and methylmalonic acid levels are typically elevated. USMLE Question 3. A 22-year-old woman with a history of chronic alcohol consumption presents with fatigue and a sore, smooth tongue. Laboratory results show macrocytic anemia, hypersegmented neutrophils, and elevated homocysteine levels. Methylmalonic acid levels are normal. The patient's dietary history indicates she has a low intake of leafy green vegetables. Which of the following is the most appropriate management for this patient? A. Folic acid supplementation. B. Vitamin B12 supplementation. C. Iron supplementation. Vitamin C supplementation. E. Hydroxyurea. Folic acid supplementation explanation. This patient's symptoms of macrocytic anemia, hypersegmented neutrophils, and smooth tongue with normal methylmalonic acid levels and elevated homocysteine point to a diagnosis of folate deficiency. Folate deficiency is common in chronic alcohol use due to impaired absorption and poor dietary intake. The appropriate treatment is folic acid supplementation, which should be initiated to correct the deficiency and prevent neural tube defects in case of pregnancy planning. Vitamin B12 deficiency can be ruled out by the normal methylmalonic acid levels.